Oh, arigato, Coco.
Oh, oh, you look beautiful.
Oh, thank you. You're gorgeous. So glad to have you
Great.
here.
Thank you so
Wonderful.
much.
Thank you so much for your time. I'm so
Yeah,
excited to,
me too.
have this live with you, and
Yes,
I'm sure we're going to learn a lot. So,
great.
yeah, many people are joining. Hello,
Oh, that's a
everyone.
hi,
Yes, hello,
everyone.
everyone.
That's great.
All right, so
Yeah.
here is gorgeous, beautiful, energized Koko Hayashi.
Yes.
She is
Hi.
a face yoga expert. She is
Hmm.
face yoga, a celebrity face yoga trainer. She has been in multiple TV shows, including two appearances in Shark Tank. And I love what she said in one of them. She called
Oh,
her technique the fountain of youth. So we are
yes.
here. I'm very thirsty to drink a lot of water from your
Yes,
fountain of youth.
yes.
And I found Coco's approach very much aligned with my holistic approach to oral health and overall health. And I'm fascinated with your technique about face posture, and especially the emphasis that you make on the importance of the tongue position,
Mm.
exercising the tongue position, because honestly, I treat a lot of patients with sleep disorder problems, and I call it lazy tongue. As people get older, their tongue elasticity is less, and then
Mm.
they start having a snoring problem and all of that. So your
Mm.
technique, I find it, I am starting using it myself, and
Oh, that's
it's
great.
the pain that I feel in the muscles, I know it's
Mm.
working. like
Oh,
like a
that's
good pain,
great.
like a good pain.
Yeah, that's
So
great.
here we are, and Coco, because of the pandemic, I know there are some people that might be hesitant going outside to get cosmetic services, things like that.
Mm.
If you can teach us things that we can do at home to stay beautiful and young, would be great.
Mm. That's great. Yeah. So our face yoga has so many exercises, but the most important thing is face posture, including
Yeah.
tongue posture, because exercise is each one is like 10 seconds or 20 seconds. It's very short time, and you do little by little throughout the day, and then in total it should be like 3 to 5 minutes per day in total only,
Oh,
unlike body exercise. Yeah, because
oh,
facial muscles are so tiny compared to
yeah.
other body muscles. So if you are, even if you do some good exercises, if you keep doing bad face posture, tongue posture, you're not gonna see good result. So
Yes.
let's talk about the face posture first.
Sure.
Great. So if you people who are watching this, any questions, please feel free to throw any questions. Yeah, we would love to answer. So
Yes.
does anyone know here who are in this chat live stream, anyone know what face posture is? Dr. Afzali, did you have any idea what face posture
Yes,
before?
basically, my concept of face posture is that, like, the things that we do that it can be bad or it can be good. Like some of the bad face postures would be frowning,
Mm.
like especially I catch myself when I'm on my phone. I see
Yeah.
that, I'm frowning, and this is the truth. As I
Mm.
started it, being on my phone longer, I felt like that my face is collapsing.
Mm.
So I definitely agree with your concept that no matter what you do, but if the face posture is not there, is going to,
Mm.
adversely affect you. Another thing is the posture that we have during eating. Are we swallowing the food, or we really using all the masticatory muscles, all of our muscles to our advantage, not only to have better digestion
Mm.
and benefit from all the nutrients that is in our food, but also to have exercise our muscles during
Mm.
eating. So,
Mm.
but I'm sure that I can learn a lot from you.
I hope so. But so let's today talk about the face posture, including tongue posture, and how to drink because I have something to drink. I hope you do you have something
Yes,
to drink after
yeah, I
Afzali?
do have some water. Yes.
Oh, great, great. And let's talk about how to eat as well.
Yes.
Yeah. So if you do you have something to eat right now?
I don't have
Oh, it's
something, but
okay. It's okay. I can demonstrate. Yeah.
okay, all right.
So the face posture is a face right now. The people who are watching this, your face right now is your face posture, which means resting face. When your face is not doing anything, when your face is not talking, not chewing, not speaking, not doing anything, that face is your face, resting face, and we call it the face posture. So 101, the most important thing is tongue. Yeah. You have a long tongue, Dr. Afzali.
Oh, I'm so glad to hear that because I've been working on it.
Oh yeah,
Yeah,
I
yeah.
learned. Is it true? I would like to ask, is it true the tongue is a big muscle and the more you training, they become longer because more elastic?
Yes, and another aspect of it is when you encourage your tongue in the protrusive position, like out, then you are helping all the muscles in the throat, and also, you know, you clear up the space for your throat. You know, it's just like a lazy setting. You get the muscles toned to the and give them the habit of coming forward, like going backward. We don't want them tongue backward. We want it up on the palate. And you know, you mentioned that you
Yes,
have
yes.
great explanation about that. So I love you to
Oh,
please
it's great.
share with all of us.
So everyone in this, right now we have 45 people in the live stream. So I would like to ask a question. Three answers. So tell me one of them. So when your face is resting, close your mouth. Everyone close your mouth, but not tension, just simply gently close. And tell me, where is your tongue? This is your upper teeth. This is your, let's use this. Upper teeth, lower teeth. This is your tongue. Option 1 is touching on the upper palate. Option 2 is in the middle. Option 3 is laying on the bottom. Please let me know. Oh, see, Senorita top, behind the teeth. Tell me.
Yeah, mine is on the floor of my mouth. On
upper palate.
Yeah,
option
not
1. Oh, that's great. Lots of people are option 1. Oh, Austin as well. Option 1. Yay, that's great. Oh, Amir, middle, laying on the bottom. Oh, okay. 85% of the people are on the top, and some people are in the middle, and some people are on the bottom. Before I knew this thing 5 years ago, my tongue was on the bottom, which is the worst.
Yeah, so is mine right now.
Worst, because if the tongue is laying on the bottom chin, everything is down. There are two kinds of facial muscles: overworking muscle and sleeping muscle. And this one is overworking of chin tension, This is overworking muscle that you don't wanna train. But if the tongue is down, it's always so you get more nasolabial line because it's pulling down, neckline, the jaw, saggy, chin tension, like it's not good. So the answer is on the top, but this is not good yet. This is good, but it's not the best. Okay. The best one, so this is your upper teeth, this is your palate. So it might be like this. The answer is this. The difference, this or this. So let me show you my mouth. Not good enough. Good one. The best one is
So it's a suction.
Yes, suction. So right before you click it, that there's a suction. So So please try, everyone. I would like to know if you can do it. That's the, and when you do that sucking, say and when you say oh, Masasi, Dr. Afzali, you look great.
Oh, thank you. She's my niece. Hi, Mary John. I love
Oh, really?
you. I love you.
That's great. Yeah. So when you say and, you feel like you are expanding fully, the tongue is fully attached on the palate to this side, not this side, but to this side.
Horizontal. You want
horizontal? Yes,
yeah,
horizontal.
exactly.
You want to have the tongue fully horizontally touched on the palate this way, okay. Ideally. And then the tip of the tongue is, I think someone people said touching on the upper teeth, which is very, very common, which happens to me as well. But this is not good enough, because if you keep doing, if the tip of the tongue touching upper teeth, and then it's come out, overbite, then you get the bad alignment.
Yes.
So I would like to ask Dr. Afzali, what are the main causes of bad teeth alignment?
Basically, there are structural issues from the insufficient growth, but the point is that, Coco, the children right now, like one of my focuses is myofunctional therapy, that I use appliances to guide the growth of the jaw to allow to create room for all the teeth to come, so they're not protruding out, and work on the width of the arch. But also the appliance that I use, it positions the tongue on the palate. It's called the habit corrector, that it basically try to correct the bad habit of the tongue. And I do have one of those appliances at home myself, that sometimes at night I use it.
Oh, okay.
So basically, what you're saying is so true, and like patients end up with the less insufficient width of the jaw, upper jaw, and then their teeth go in the wrong direction. And orthodontically, you know, I can move it, but the success would be much higher when the position of the tongue is properly, you know, reestablished.
Yes.
So yeah.
When your face is resting, when you're awake, you can control it. When you're sleeping, you cannot do so. You might want to
use the appliance. Exactly. Yeah, that's why the combination of your work, like what you do, is just so much aligned with what I work on.
Yeah. So both are equally important.
Yes.
Yeah.
Yes, definitely.
So the tip of the tongue, a lot of people touching on the upper palate, upper teeth. Ideally, it should be like here. What do you think, Dr. Afzali? This is what I learned from Japanese doctor.
That the tip of the tongue needs to be in the palate.
Yeah,
right, right in the, yes, in the premaxilla. We call it the premaxilla area. Yes, and this is correct in a lot of senses, depending on what type of situation we have. Some people, like the one that have the protruded jaw, and unfortunately, a lot of these people end up with surgery, which I am treating some of these cases without surgery. And one of the points is that I keep emphasizing on the position of the tongue, and absolutely it does make sense. The premaxilla is a suture that is separates palate, and when we put the tongue there, you know, we push that suture in. You know, we can trust our body and the intelligence of our system, that if we just use everything the way that it's supposed to be and the correct posture. That's why I'm fascinated with your concept about face posture.
That's
When we
great.
have that correct posture, then the function is going to guide the structure in the maintain the structure properly. You know, we have to get the structure where it's supposed to be, and then support it with the correct posture and function.
That's great. So people in this live stream, did anyone get this, the sucking? Did the people understand this? Because this is the most important thing.
So when do we do in the rest position, we will be having that sucking, like that suction position?
Yes, always, always.
Always.
Unless you are drinking, talking, eating, or something, if you are just looking at this live stream, which I think you are, and then that's your resting face. So you should keep always sucking up, always.
Okay. Great.
Yeah, so for some people, lots of, I was able to do it. I'm trying to download your face yoga paper. That's if you cannot download this, yeah, by the way, this face yoga paper is downloadable, free download on our website, cocofaceyoga.com. So if you cannot do that, please email us, smile@cocofaceyoga.com, so we can send it to you. Yes, 5M says, do we do this all the time? Yes. Yes.
Okay.
I know it's hard. Okay, but face posture, it's not just this. It's not just tongue. There are more. So the second important thing is your body posture. If your body right now, check your body right now. If you do like this or like this, yeah, your body and face all connected. So it's impossible to have good face posture without good body posture. Both has to be good. So assuming you are sitting right now, let's relax your body, spine. So like this, tilt a little bit, and then try to get good spine. So spine is like this, beep, 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 straight. And then head is on your butt. Not this, not this. But head is on your butt. Yeah, it's hard. And then the next one is corners of the mouth. So now we talk about the body and the tongue posture, but very often with age, all the muscle become weaker, and then the corners of the mouth start. I'm exaggerating, but if you're not conscious about it, it's easy to do like this. And then what happens, you get more, it's pulling it down. You don't, not just you look bad, but also you get more nasolabial jaw, chin tension, saggy, everything is sagging. You lose the cheekbone muscle, everything, cheekbone meltdown happens. So not good. So always the tongue is up and corners of the mouth just a little bit up. So let me show you. See, it's very, very tiny, very, very tiny. I don't want you to smile too much, but yeah, those very important.
Great. Coco, we have questions about people that are grinding their teeth, and I think they're asking if there are some face postures and some exercises that can help with the grinding. Yeah, that would be a great subject.
Yes, so that is TCH. Teeth contact habit. This is what I learned from my Japanese dentist as well. But when your face is resting, I learned that upper teeth, lower teeth should not be touching. It was touching. Mine was touching before I knew this. So if it's touching, that creates slight pressure, but it's long time, 23 hours or something, almost not 24 hours because you're eating or something, but like 23 hours, you're pressing a little bit, gentle, but the long pressure. So some dentists said TCH is worse than grinding. I don't know what you agree, but
you know what you're saying is so true, because for patients that have TMJ pain, the first thing that I do, I put them in a regimen or appliance to separate their front teeth, because that would set the TMJ, relaxes the TMJ, and then when the TMJ is relaxed, then the muscles are not fired up, because when there is a discrepancy in the bite, the imbalances in the bite, and the teeth come together, there are perioceptors at the root of the teeth that send the signal to the brain, and then the muscles, which are very strong muscles, masseter muscles that are in our face, they start to fire up. And you see some people have bulky faces when they have TMJ. In bulky faces, you see that the teeth are very short. They are grinding their teeth. They're knocking out the teeth by firing up the muscles and grinding. So what you say is absolutely true.
Oh, thank you. Yeah,
Sure.
so that's what I learned from Japanese dentist. And so when your face is resting, upper teeth, lower teeth should not be touching. It should be very, very, very little, almost nothing, but very little gap in between. Yeah. Oh, another question. I have a sleep apnea, cannot sleep on my back. And any advice to avoid the nasolabial falls? Yeah, this is another thing. If you are sleeping with side like this, 28 hours per day, then you get more line. So I like doing back sleeping with special pillow like this.
Oh, wow.
So if I want to do this, it blocks me. So I might be still sleeping like I'm still sleeping like this, still a little bit side sleeping, but not too much. So this, it will be my, just search back sleeping pillow, back sleep support pillow or something on Amazon, and I've been doing like this. This is my fourth pillow for the past 5 years.
Okay, great. And by the way, Coco, to me, when I saw you, I thought you were in your 20s. You look so beautiful and young.
Oh, thank you. I'm 41 years old this year.
Wow, you're gorgeous and beautiful. And you showed, do you have the picture of yourself before and after yoga? Could you please share that with us?
Yes, this is more 31, chubby. Body is always chubby. I'm sorry. Body is always same. Japanese don't lose weight, don't gain weight. It's always same. I'm Japanese. So yeah, it was more, this is cute, but it's much chubbier. And I didn't like this. So I was doing some exercise.
Yes.
I'm still do. Yeah.
Yeah, and I know that there are some procedures like I am on the natural, holistic, non-invasive concept. That's my concept. And I like the gentle side of medicine. I call it the human side of medicine. And I know that some people don't mind about more invasive procedures, but there are some procedures that now the part of the muscles of the cheeks are removed to create effect that you have created. So anyone can come to can check out on your website if they want to have a slimmer face, and you have exercises that they can follow.
There are so many exercises.
Okay, wonderful. Great.
Yeah, we have a YouTube, just search Koko Face Yoga, but not C, but KOKO, and the website. And Pillow is going to be, just DM us or email us, and then we will send you the link. So let's now talk about eating. But before we do eating, it's easier to do if we do drinking first. Drinking and eating are kind of a set. So let's do drinking, how to drink.
All right. That's right.
So regular eating, traditional eating, drinking is if you have like this, so many wrinkle, tension in the gym. I was doing, and then I was doing because otherwise I'll just spill the water. So unconsciously, people are doing, I'm exaggerating, but no. This is another overworking muscle that you want to relax. So what I do, or what I've been doing for the past years, is when you drink, a little bit tiny smile. A little bit tiny. Don't drink a lot of water. If you have if you have very something to drink, please try it. Otherwise, it's hard to understand. I hope you have something to drink. So tiny smile. But don't drink too much water because this is a practice. So if you practice with a lot of water, you're gonna spill. I used to do that all the time. And another one, if you use like water bottle is not a good tool for the purpose of practice. For the purpose of practice, something like this wider one is better, not the tiny water bottle one. So if you, yep. And then if you do tiny smile, you reduce the tension in the chin.
Yes.
Please let us know if you feel it. And then you lift up more here. Basically, you want to drink with the cheeks. Because cheeks are sleeping. Cheeks are, we want to wake up the cheek muscle to build more muscle to lift up higher, fuller. And we want to forget about this chin. So tiny, don't do like this. So head is on your butt, but tiny smile a little bit and smaller amount so that you don't spill the water. And then when you swallow, again, tongue posture. So when you swallow, when you drink the water, this is like this, but like this. I mean, like, So let me show you my tongue, not my neck. See the movement, tongue. So try again. Let's try everyone again. Everyone has water. Then tiny head is on your butt, not sticking out. And then smaller amount. Then tiny smile, tiny smile. And then, Do you feel it? So every time you swallow, I would like you to feel the sucking up. Do you feel it? If you can master this, every time you drink something, you are doing a good posture. And then every time you are lifting up your face, and the tongue is another big muscle which is connected to neck, as Dr. Afzali said. So every time you swallow, you are toning the neck. So if you're concerned about double chin or saggy neck or those things, you should be doing this. There are some exercises for neck exercise, but every day we drink. I don't know how many times we drink, but every time we swallow so many times. So if you do this as a natural habit, imagine that you are toning the neck and lifting your face every time you drink something. So that's okay. Yeah, 5M. Yes, that's good. Did you get it? I hope to see you. Please chat with us so I understand. Yeah, this is not easy, so I wasn't sure if you understand. Okay, so this is a drinking. What did you think about this, Dr. Afzali?
I really liked it. First of all, I believe the facial posture that we display send a signal to our brain, and it sets up our emotion also. Like if we can change the frowning face to a smiley face, from what I'm hearing from you, not only it is going to help us emotionally, it is going to help us our immune system, but also is going to help us to stay younger and have a more youthful appearance. And it does make sense. When we smile, things are lifted. When we are frowning, things are in the direction of gravity, and they are droopy. So that definitely makes sense, and I could feel the difference as I was drinking. But the importance of it is also keeping the body posture in the right position. That was something that I wasn't paying attention. And as during eating, keeping the same body posture and bringing the hand to the mouth rather than bringing the mouth to the hand. That would be a way that could help us. And also I believe is going to help with the weight management, because when we are putting that much awareness in our actions during eating, we're going to be allowing our body to really consume and benefit from what we are eating, rather than getting filled up pretty quickly, and then the brain misses the signals. The brain, it could prevent overeating as well, and we just eat enough.
Yeah, definitely. Yeah, because if you the true eating, lift up eating system that we're gonna talk about from now, if you do this, you cannot do overeat. It has to be very slow. So it's good for weight loss as well.
Yes. And so overall health, just our body is not going to be overburdened with so much, at once. Can you imagine like the stomach and the digestive system, what type of job they have when they receive the food unprocessed? And, the first step of digestion, which takes place in our mouth, with our teeth, when that is incomplete, then definitely the other organs have to take the burden.
Oh, somebody asked, what does Dr. Afzali? She's an orthodontist, right?
I am a general dentist. I'm a functional dentist, but my emphasis is on orthodontic treatments. I treat a lot of patients that have been told that their only option is surgery. I've been treating them with different advanced orthodontic techniques that I use. I treat patients with sleep disorders, with sleep breathing disorders, children. Is one of my emphasis on helping children that are having sleep apnea or sleep breathing disorders. I treat TMJ, temporomandibular joints, everything that is on the foundation and reestablishing the system of our masticatory system. That's the area of my emphasis.
Okay, great. So as I have a nut, so we're gonna now talk about the how to eat. So sorry that I can answer other questions that like CrossFit, those are things, please DM us, and or please go to my website and ask AI Koko. If the AI Koko of the robot cannot answer, I will answer, so please do that. And this is not. So regular eating, bad example, traditional regular eating is like, again, sticking out a little bit, like Dr. Afzali said, Koko. Only this side, or only this side. Lots of people do concerned about asymmetrical face, and then those people, most of the time, chewing on one side only, 80%, 20%, not 50-50, but 80%, this side only. And then my tongue is like all over the world in the mouth. And then tongue, when I swallow, tongue is not really pressing up. Tongue is like dancing around. That's it. This is not good. So I believe what we like is you get some smaller amount for the purpose of practice. Don't not eat hamburger. If you eat like a big stuff, and then you have to do like this and open big mouth. Opening a big mouth is not good unless you are a dentist, because you stretch the skin, then the jaw is dropping. This is overworking muscle. You don't want to use. In my idea, the less you use your chin, the better. So get smaller amount. If you have chopstick, that's great. and then break down into smaller pieces to chew. And then get the food Distribute to both sides. 50%, 50%. To the back teeth. And then traditional regular eating is like this. See that? This 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 is what I don't like. This is what I don't like. So I like, instead of and pulling it down. So instead, So I'm going to exaggerate with another nut. See, my cheeks are working so hard. I'm chewing with cheeks, not mouth. I forget about mouth. Then This way, every time you eat, you are lifting up your cheeks. And then, of course, when you swallow, tongue is lifting up the palate. Yeah. What do you think about this, Dr. Afzali?
I'm trying to practice because I don't have anything to eat right now. I love the concept because, working out the cheek muscles is something that we can all benefit from. And also, I think you're the expert, but I think it also protects our under eyes. When the cheek muscles are not droopy, then we're not going to get those hollow. I mean, you help me with that.
Yeah. If you have lots of hollow or eye back or some kind of line, what you want to do is build the cheek muscle. If you have higher flat cheeks, that's gonna disappear. So this is like so important, especially this is a big part of the face. People pay attention to something big. People not gonna notice any tiny wrinkle, pigment or acne. Those are tiny things. Don't worry about it. Worry about something big like cheeks. People pay attention to something big. But also there's another thing I wanted to ask Dr. Afzali is that I learned from a Japanese book, every time you eat something, and then tongue is like in, out, in, out, in, out, in, out. Oh, this is a palate. This is a palate. This is a big palate. But in the middle of the palate, in, out, in, out, in, out, in, out. This is what I learned from a Japanese book by a dentist.
As you are chewing, basically the main focus is that, again, you want to get the tongue to work. The tongue is, I really believe in our traditional education, it's been overlooked to teach us, the professionals, the importance of all the functions of the tongue and how we can utilize the tongue in exercises during our eating is just the whole part of mastication system. Absolutely. And then, as I said, that we control the width of the jaw with the tongue. There is actually a gentleman, a dentist in England.
Dr. Mew.
Yes, Dr. Mew. Yeah, yes. That he has his whole concept. He's changing the facial structures with the tongue position. Just
mewing.
With mewing. So I'm a strong believer in that. I definitely believe in that, and I believe part of the reason that some of the orthodontic works will relapse is because of the myofunctional habits that are not corrected, and the patient does not have awareness about these habits. Like you correct the structure, but if the habits continue to be the same, you have improvement, but definitely there is going to be some relapse. So from that perspective also, definitely.
Yes. So before I learned this in, out, in, that my tongue should be like this in the middle. Before I learned this, it was this. So of course I'm gonna get asymmetrical face. So if you are want to have more symmetrical face, chewing on the both sides, and then also tongue should be in the middle. That's I learned that otherwise it was always like this, not here, but always here. So be aware of that. So let's do review that, summarize. When you eat something, get smaller pieces, not big one. If you have big one, you have to do. You don't want to use the chin. You don't want to have bad posture. So always good posture. Head is on your butt. Like, yeah. So not like this, but like this, in smaller pieces, and then break down to smaller pieces, and then bring it to 50%, 50% on the both sides, and then back of the teeth. Bring it to the bottom, and then no. So always imagine that you are chewing with cheeks, and then tongue is in the middle, which is hard for me. And then when you swallow, this is your tongue. So on the palate, like this. So that's so every time you eat, you are correcting the asymmetrical face, you are lifting up your cheeks, you're reducing chin tension, you are toning your neck. Oh my gosh, you're beautiful.
So that's what I am so fascinated about your concept. You know, we don't need to put additional time. We can just correct our habits, and then we can benefit from a healthier face, a healthier digestive system. And you know, it's very interesting what you were mentioning. When I do braces for my patients, often I would say about 90% of the time I see that one side is lagging another side, and that is absolutely due to the favoring one side on chewing rather
definitely
than the other one. So this is so important, and definitely I'm going to direct my patients to your techniques, and you know, because it complements what I do. Your work complements it very well.
Neil Appel says, what about people who have dental issue one side?
Yes, that's a very important thing. In fact, as Koko was explaining it, I thought about it. That's so important to take care of your dental issue. And most importantly, please, please, please have your dentist check your bite. You want a balanced bite. It's called occlusion, the way that your upper and lower teeth touch. They need to be on even forces all along the teeth. If you one side, even if one tooth is a little bit off balance, then your body just try to shift to the other side and try to avoid that side. So it's very important that you have a balanced bite and you are utilizing both sides. And one thing that I always tell my patients is that dentistry becomes painful, scary, and expensive when it's not detected at the earliest stage and when it is ignored. You know, if you have regular checkups, and if your dentist also is on very much on the preventative side, you know, there are, when cavities are at the very earliest stage, we don't even use drills or shots. We just restore the enamel of the tooth. When the cavity is within the enamel, we have a technique in our office that, you know, without any drill, without any fillings, anything, we reverse the cavity. And especially for young children, I highly recommend parents to, you know, take them to the doctor. And if you hear one thing while we are on the subject of dentistry, if you have a diagnosis, if you are told before you get braces you need to have your teeth extracted, please get a second opinion. Because one of the causes that right now we are dealing with sleep apnea as an epidemic is because of this elective extraction of the bicuspid teeth and shoving everything down. First of all, the facial muscles are going to be affected as people, age. When we shrink the size of the jaw, we are reducing the space for the tongue and all these important functions that the tongue has. So I do non-extraction and non-surgical orthodontics for the very same reason. And I fight for every tooth that is in my patient's mouth. Sometimes people come with me and say, oh, I don't like this position. I want this teeth to be pulled. I spend time explain to them why I don't want to extract their teeth. And so definitely that's something to keep in mind. You do not want to reduce the size of your arch because you are reducing the space for the tongue and all these vital functions that it has.
So I have a question, my personal question.
Sure.
When I touch my upper teeth and lower teeth, this one is more touching.
Yes. Okay.
This is not touching.
Yeah.
So it's asymmetrical. Where do I go?
Basically, it's a very simple procedure. There is a little thin paper. It's called articulating paper. We use a very thin one, and then ask the patient to bite. You just check the bite and find a spot. And usually, when there is just on one point, just with a very fine a stone, there are polishing a stone, we just take that point down a little bit, reduce it, and then the other points touch better. Yeah,
so is it orthodontist? Do I go to orthodontist?
No, you don't have to go to orthodontist. General dentists do it. Yeah.
Really?
For the orthodontic do braces is limited to orthodontics. What I do, I'm a general dentist with functional dentist. So what I do, of course, in all of my offices, I have 4 offices in Southern California. I have oral surgeon, general dentist, periodontist, endodontist, all these specialties. And what I do myself, I take care of all the structural and foundation issues, as I mentioned. And this is called, what I'm explaining to you is called equilibration. That means to equilibrate the bite. And that's part of the services that a general dentist does in their office.
Really? Do you think other dentists do this?
I cannot tell about other doctors. All I can tell you, unfortunately, this subject that we are discussing, it's not being given enough attention in the field of dentistry. That's why my focus is on patient education, because when people are educated, and all my Instagram posts, every time that I have a post, a majority of them, I am trying to bring these points on. So when people go to their doctors, they ask, and then if they see that they're not getting the answer, they can look for a doctor. Basically, a functional dentist is a general dentist that focuses on functions and look at the systems of the mouth. It's not just focusing on a tooth that has a cavity to fix it. But the functional, the doctor focuses, most of the attention is on prevention. Prevention of disharmonies, and if there are disharmonies, then work on bringing the whole system into harmony. And orthodontics is one of the tools that I use to create that harmony.
Okay, that's great. Thank you. I will look for nearby my place.
Yes,
I'm in LA. Do you have office in LA?
Yes, I have one office in downtown Los Angeles. Yes.
Oh my gosh, I should go there then.
Yes, I love to have you there, Coco.
Oh, you work there?
Yes, I am in all the offices. I do a lot of, right now, because of the COVID, every new patient that want to see me, I have virtual consults available, that we do a virtual consult, and based on what their needs is, then we take it from there. Yeah.
Oh, that's great. Yeah. Yes. So if you are interested in going to her clinic, check out website, your website. What's the website?
Yes, yeah, I have. There is Lifetime Dental of downtown LA and Lifetime Dental of Rancho Cucamonga, Lifetime Dental of San Bernardino, and Lifetime Dental of Lake Forest. So one of the locations is in Lake Forest, Orange County, and two are in Inland Empire. One is in Rancho Cucamonga, another one is in San Bernardino, and then one is in downtown LA. And the name of the practice is Lifetime Dental.
Oh, that I will go there. I will be there.
Okay, great. I love to have you.
That's great. So I think last two questions, can receding gums be reversed naturally?
Yeah, let me answer this question this way. Receding gum is a symptom of something that is not working well in your mouth.
What is this? It's this is gum. Recede.
Yes,
What does
that
receding
means that means the gum is higher and then the root is showing.
Gummy
So,
smile.
yes. So sometimes if bite is completely fine and everything else is okay, it can be the brushing habit. So maybe some people are brushing so hard, and the way to see if this is the situation, you can check the two sides and see if one side is having recession, and that is the side that, like, if you're left-handed or right-handed, that would be a corresponding opposite side would show that you are doing a stronger strokes, and then that caused the gum to go away. But majority of the time, the disharmonies on the bite are the major cause of the gum recession. And to answer your question, naturally growing gum, I have been advising my patients when they have receded gum that is just starting. I tell them massage their gum with honey, a little bit of a honey, and massaging it down. That is a little bit of an optimistic approach. If the root surface is already exposed, you will not get much. I would recommend, first of all, make sure that you don't have crooked teeth, you don't have spaces between your teeth, like from alignment aspect, everything is fine. And also from the balance. Once those are fine, then there are lesser involved procedures. Is called pinhole surgery, which basically the tissue is lifted, pulled up, and then the recession is done. In fact, in our Lake Forest office, Dr. Chang is our doctor that does the pinhole surgery. And then we have two periodontists on team that they do graft surgeries for gum recession. And we also have LANAP laser, which is a very advanced technology in laser that we use on some of these gum issues, people that have gum issues. So these are all available, and you can find it on our websites.
Also,
yes, go ahead.
Oh, sorry. Yeah, I like doing sometimes massage to relax, fascia release, and then sometimes like this down, because when you smile, this is overworking. This P is overworking. So if that gummy smile is happening, this is overworking up. So you wanna relax, down. And then also when you smile, try not to smile here too much, but try to relax the nose. I know it's hard, but I think I did some video on how to smile video. So please check it out. My my YouTube. Yeah. Relax down. Yeah.
Yes, great, wonderful. Koko, I have a question for you. As you know, we age, this area becomes longer. Is there? And I know that you mentioned that these muscles, you don't want to, play with this because those are not the muscles that you get it to work. What is there? Any other areas besides the cheek that can have an influence on like shortening this space a little bit?
This is a sleeping muscle. This is overworking, working, but this is a sleeping from
Okay.
here. So it's not easy for me to do this, but this was introduced by a dentist in Japan. But it's like how to say, you try to do kind of a dark lips, but forget about the lower lip and only with the upper lip, and then try to create the dark lip.
Yeah, I used to do this motion, but when I've
This
heard
is
you,
not good.
yeah, when you said that this is not supposed to be, the
So
chin, you're not supposed to work on
yeah,
it.
forget about I use finger because it's not easy for me. So hold it and then forget about the lower lip, but only I'm sorry, upper lip is like a dark lip.
So basically control the chin.
So maybe if I do side view,
Okay.
I don't know if you can see, but I'm trying to
Oh, okay. Forward.
forward, yeah, forward, and then keep it. Somebody's good. What about gua sha? Gua sha is a different thing, so you can ask. Please ask other questions on my website, cocofaceyoga.com, and then it's an AI Coco. So if the robot cannot answer, I will answer. So please do so. Yeah. So basically, and then keep it. This is sleeping. So and then yeah, with age, people cannot do this thing. Even this is not easy for senior people. But this is not good because, as she said, wrinkle, not good. So I like holding it and then try to do that. Then yeah, 1, 2, 3, 4, 5, 6, 7, 8, 9. Ideally longer than 10 seconds, but when you're driving, when you're working on computer, you could do this too as a face posture.
Okay, great. Thank you so much. All right. So, Coco, thank you so much. You've been very generous with your time
Thank you
and with
so
your
much.
knowledge. I really appreciate it. Please follow Koko on Instagram, Koko Hayashi. She has a lot of great information that I found it very helpful. And if
thank
you
you.
have any, sure. And if you have any questions for me, you can DM me at dr.afzali. That is the main Instagram account that you can contact me. All the other practices have Instagram accounts also, the Lifetime Dentals that I earlier mentioned. So, Coco, do you have anything else that you want to
No,
share? Or
we did a lot. So
yeah,
if we couldn't answer your question, even though you questioned us, sorry about that. But ask us ask me to our website. We have a AI Coco waiting for you.
yes,
And then you
wonderful.
can ask DM Dr. Afzali too.
Yes, and then Coco, I know that you have do you have some products? I've heard something about Amazon that or do you have any videos, any products that if someone wants to, follow you, or what is
It's
it like?
on YouTube.
On YouTube, everything is on YouTube. Okay.
Yeah, just to find Koko Face Yoga. Not
Okay.
CO, but KO Face Yoga.
Okay, wonderful.
Okay.
Yes, thank you so much.
Thank you so much.
Yes, and there would be a recording of this live, both at Koko Hayashi Instagram account and on Dr. Afzali. Thanks everyone for joining us. It was wonderful to see you, and a lot of love for all of you that been sending all your beautiful loves on this side screen. And I hope we have some future.
Yeah, maybe you should do
together too.
on YouTube because you
Yes.
have different audience. They want to know.
Sure, absolutely.